drawing of what's going on. Okay. Vena cava. Portal vein. Okay. So, Kobe has what's called a portosystemic shunt. Okay. I'm Dr. Sherman. So Kobe has what's called a portosystemic shunt. So usually in normal dogs, okay, the intestines and the spleen, okay, all drain into something called the portal vein, which goes to the liver, okay? And the liver is responsible for filtering out all of the toxins that are produced when you digest things, and everything that the spleen is responsible for filtering out as well, okay? What Kobe has is, instead of these things going to the portal vein, there is a vessel from the portal vein connected to the vena cava, okay? So that blood, instead of going up this way, is actually shunting this way. And so the liver, this becomes very small. And now the liver doesn't get that blood flow from the portal vein. Nothing's being filtered by the liver, and the vena cava goes into systemic circulation and up to the heart, okay? And so these toxins that should be being filtered by the liver are actually not being filtered and going into systemic circulation, okay? And these can cause a lot of different clinical signs that we see in dogs, all right? Fortunately, Kobe doesn't really have any of those clinical signs right now. And do you live with him, or no? Do you don't live with him?
No, I don't,
Okay.
but I see him a lot.
Okay. So typically sometimes they'll get, because a lot of the proteins are what causes this, after eating meals, you may see him be much more tired than a typical dog. That's why we recommend the low protein diet. Okay, they can develop bladder stones, they can develop seizures, they can have GI effects, they can develop anemia, they can have blood work abnormalities, okay? All of these things that can lead to different types of clinical signs. Fortunately, in Kobe, we're not really seeing any of those, okay? He kind of has almost an incidental shunt that we caught on blood work, which is both good news and bad news, okay? The good news is that if we get rid of this shunt, okay, then he should continue to be normal and can live a normal life afterwards, all right? The bad news is doing this carries some pretty significant risk surgically, okay? And there is the potential that doing this, some of these risks that we can have and some of these complications that can happen surgically can actually be fatal, okay? The number one complication that I worry about that can be fatal is seizures post-operatively, okay? And seizures can happen for many different reasons post-operatively. And they're related to many different factors, but essentially, if this gets closed too quickly, okay, if we close this off completely, let's say we just tie that off, now all the blood that was previously being shunted is now going to this area. And the liver, which hasn't been handling that much blood, gets overworked and overloaded, and this leads to something called portal hypertension, okay? And portal hypertension can make dogs very, very sick, and he can go into shock for that reason, okay? This can also be accompanied by seizures, okay? Secondary to a lot of these chemicals being kind of mixed through the blood, the liver not being able to do its job, okay? There can be bleeding, okay? Usually, if there's gonna be bleeding, it's gonna be intraoperatively, and I'll kind of discuss why afterwards. There can be hypoglycemia, meaning low blood sugar afterwards, and that's because the liver, again, a liver function problem, and he's a young dog. He's actually a little bit older than the dogs we typically do this surgery in. So for whatever reason, his shunt isn't affecting him that much. That's why his clinical signs aren't that affected, okay? Those are the four big ones that we can see. I guess N5 would be hypoproteinemia. And again, this is secondary to the liver abnormality.